Good morning and welcome to Brain Health Series 7. This is going to be our presentation on nutrition and brain health. I'm Dr. Victoria Russo, and I'm supervisor with the City of Chicago Department of Family and Support Services, Senior Services Division. Our presenter today is Dr. Puja Agarwal, and she is a nutritionist and nutritional epidemiologist at the Rush Alzheimer's Disease Center and an assistant professor in the Department of International Medicine at Rush University Medical Center. Her research focuses on how lifestyle factors, specifically diet and nutrition, including dietary patterns, specific nutrients, and related metabolism, may prevent or delay neurodegenerative diseases among diverse older adults. Her past and current research work is funded by the National Institute of Health, the Michael J. Fox Foundation for Parkinson's Research, and the Alzheimer's Association. Dr. Agarwal believes that identifying healthy diet as a modifiable risk factor for various age-related health outcomes and maintaining healthy brains can have a huge public health impact. It is my pleasure today to introduce you to Dr. Puja Agarwal. Thank you.
Thank you so much for the introduction, Dr. Russo. It's a pleasure to share our work and something I'm passionate about. So let me know if you can see my screen. I am just sharing it now.
Looks great.
Okay. So as Dr. Russo mentioned, I'll be talking primarily about nutrition and brain health and focusing on why eating healthy really is important for aging. So we will broadly go over why what we eat is important. We will go over the macronutrients and the micronutrients that are associated with cognition and how diet can support brain health. And we will talk about some of the dietary patterns, including the Mind and the Mediterranean diet. And then we'll also talk about how unhealthy foods may attenuate the beneficial effect of the healthy diet. So moving on, why is it important? Because like our population, our aging population is increasing over time. And we also know that the rate of Alzheimer's disease is also increasing. One in every three senior dies of Alzheimer's or other dementia. So it is a huge public health concern. And we are working on different lifestyle factors that can reduce dementia risk. And one of them today I'm going to talk about is diet. Now, WHO also came up with their action plan to reduce the dementia risk, and they have listed a lot of modifiable risk factors, including maintaining your weight, physical activity, alcohol and smoking, and other cardiovascular risk factors, including diabetes, hypertension, and then also dealing with education, cognitive activities, and depression. However, something that obviously stood out for our area of research is unbalanced diet. That means that the balanced and healthy diet is an important component of WHO action area also to reduce dementia risk. So why eating healthy diet is important? Because when you eat a diet, again, food is always consumed in combinations and you eat different kinds of food. So they all provide you essential nutrients. The food also helps you to maintain weight. It helps you to maintain your cardiovascular health, including diabetes and hypertension. And then it also helps with better immunity to prevent you with certain illnesses. And here is just a theoretical diagram on what we are trying to study at Rush. And today I'll be showing you main evidence we have from human studies. And what we are trying to do here is we're trying to see if what people eat impacts their overall outcomes such as Alzheimer's dementia risk, cognitive impairment, depressive symptoms, type disability. And we also try to look at if what they eat impacts their brain integrity, connectivity, or neuronal resource and other kind of outcomes that gives us an evidence like how what you eat impacts your brain. So now why nutrient is important for your brain? Your brain needs different essential nutrients and bioactive compounds that are coming from different food sources and that are very much essential for the maintenance and the functioning of your brain as you age. So these nutrients are not only helping you to maintain the brain, but it brain function. It helps you with overall brain connectivity, maintains the brain volume, and also helps you to clear out the unwanted mm, plaques or like these creations or formations of the brain that can impact your cognitive or motor abilities. Now, we will talk about different nutrients. So we can say that we can divide nutrients into two groups, the macronutrients and the micronutrients. I will first go over the macronutrients. So the macronutrients are the main sources of energy in your diet. So that consists of carbohydrates, proteins, and fats. And macronutrients are very much essential in large amounts to give you energy, and proteins are the building blocks, and you need fats because there are certain essential fats that are very much needed in your diet. Now, coming on to carbohydrates, there are complex carbohydrates, which include whole grain. And the studies have found that people who were eating whole grains, such as the complex carbohydrates, have higher cognitive function. So when I say complex carbohydrate, that means more of like whole grains, quinoa, kashi, and like other kind of whole grains, buckwheat, whole wheat, or eating whole wheat pastas and breads and other kind of whole wheat items you can consume in your daily life. It was something that was counted for these older adults. And then they tried and established their association with the cognitive function they were having. So better the intake of whole grain, better was their cognitive function. Similarly, there have been studies, and this was done by our group, where we looked at the sugar intake. Sugar is the simplest carbohydrate form. And you might have heard it from a lot of other literature that sugars are not good. Sugar is not good for cardiovascular health. And we also found that sugar is not good for dementia as well. So what we did in the study was looked at people's sugar intake coming from different food sources. That includes like simple white bread, all kind of sodas, cookies, cakes, or maybe sugared cereals or sweets and pastries. So we added all the sugar intake they were consuming and then looked at how they performed on their dementia diagnosis over the year. So as you can see here, the red line is people who were eating more sugar in their diet. And you can see there is an increase of red line as our time increases. So time means number of years we have followed these people. And we found that those people who were eating more sugar had double the risk of developing dementia with age. Whereas the blue line is the people who were consuming less sugar and they were having low risk. So again, higher sugar increases your risk for dementia. That's what was found here. Now coming on to the second macronutrient, protein. I'm sure a lot of you have heard all about proteins. There are different kind of proteins, but our main focus with age is and the aging population is to focus on lean meats, beans and legumes and nuts and low-fat cheese that are good sources of protein and give you a limited amount of fat. So protein intake was found to be positively associated with cognitive function in one of the studies. And overall, protein intake is also essential because it helps to maintain your muscle mass in aging and also supports different motor function. So protein is another important macronutrient. And now coming on to fats. And I'm sure you have heard a lot about different kinds of fats and primarily that there are good fats and the bad fats. So when we say there is good fat, That includes the essential fatty acid, which you really need to maintain your brain health and your cardiovascular health. And this good fat includes omega-3 fatty acids and also monounsaturated fatty acids. However, the bad fat includes saturated fats or the trans fatty acids. So when we talk about good fat, we are talking about the omega-3s in the fish or in different kind of oils or monounsaturated fats in olive oil or also avocado that can help cognition. And when we talk about the bad fat, it includes saturated fats in the baked foods, in the bakeries, in the sweets and pastries that has been associated with poor cognition. And obviously, because good fat has impact on different outcomes, one should include more of good fats in the diet and try to decrease the bad fat in the diet. And there is also a ratio of saturated and unsaturated fatty acid that has been associated with your LDL cholesterol and the HDL cholesterol, the good and the bad cholesterol. So again, the type of the fat you consume is also associated with your cardiovascular related outcomes, such as cholesterols. And there are different animal studies that have shown that high saturated fat or a cholesterol diet can impair your memory and also increase the beta amyloid, like the specific hallmark of Alzheimer's disease. The higher saturated fat or high cholesterol diet was actually making the more of these beta amyloids in the brain of these animals. So overall, consuming more of good fat and limiting your bad fat is the key when it comes to the fat intake. Another good fat, we just talked about it, the omega-3 fatty acids. I just want to reiterate the fact that why it is so important. Like the omega-3, one of the very good sources, fish or seafood. The other sources includes like different kind of seeds, now chia seeds, etc., for those who are vegetarians. But then the overall idea is to consume more omega-3 in your diet. Why is that so? Because it is also considered as brain food. Some people do call it as a brain food. And why is that so? Because our overall brain is consisting 50 to 60% lipids. When I say lipid, that means like the lipid is another form we can address fat as. And it is important for brain functions such as maintaining brain cells and its connectivity. And there are studies that have shown that consuming at least once a week fish or more can improve your brain health because in that study, it was found that those who were consuming fish had better cognitive function and were declining slowly as they were aging. So omega-3 is a very important component when it comes to fat in your diet. Now moving on to from macronutrients to micronutrients. So when I say micronutrient, that includes all your vitamins and minerals in the diet that come from different food sources, all the colorful fruits and vegetables, and all the whole grains and all different kind of fats and other sources of food can also give you these micronutrients. And we will go over some of them. Mostly the micronutrients or I'm also including bioactive compounds here. So bioactive compounds are not like actually nutrients, but that are the compounds found in the foods that are essential and also have antioxidant and anti-inflammatory property. When we say antioxidant and anti-inflammatory property, that means once it gets into your system, once you eat them, these nutrients are helping you to fight the free radicals. It helps you to maintain any kind of extra production of inflammation in the body and stuff like that. So primarily micronutrients that I will briefly talk about today includes carotenoids and vitamin E and also flavonoids. And then also the role of vitamin B for brain health. So let's look at them one by one. So coming on to carotenoids. Carotenoids is another this actually is the naturally present pigment in different fruits and vegetables, specifically the red, yellow, orange, dark green fruits and vegetables. And the studies have shown it's associated with 47% reduced risk of Alzheimer's dementia, which is huge. So overall, consuming 1 to 2 servings of green leafy vegetables daily was equivalent to being 11 years younger in terms of brain age compared to those who were eating it rarely. Again, these are the studies which have been reported by our group and others. So when I say carotenoid, it's a subgroup of vitamin A. Um, and then now moving from carotenoids to another important vitamin, which is vitamin E. Vitamin E comes from different food sources, again, different fruits and vegetables, and also oils, some of the oils. And this is another study that was done at Rush a long time back. This was a study done by Dr. Morris, who's my mentor and a pioneer in the field of nutrition and neurodegenerative diseases. What she found was that people who were consuming very low vitamin E in their foods, which is the pink line. Pink line is the people who are eating low vitamin E in their diet. And it was found that they had a faster cognitive decline over the years of follow-up. So this line, a steep decline line, shows how their cognition was rapidly decreasing and how they were progressing towards being cognitively impaired, you can say. So that again brings the fact that vitamin E from your food is important and helps to maintain your cognitive health. Then coming on to vitamin B, we have different food sources, including the meat sources, which are a very good source of vitamin B12 and like B9 and other forms of vitamin B. And then there are fruits and vegetables and legumes and whole grains that are also sources of vitamin B. There have been different studies all across the globe for the role of vitamin B and cognition. And one of the meta-analysis is something which puts different studies together. And there was this meta-analysis putting 90 studies together on vitamin B and then looking at them all together and found that vitamin B intake is associated with slower cognitive decline. Similarly, we have other studies looking at flavonoids. As I mentioned earlier, this is a bioactive compound present in fruits and vegetables in different forms. And our group has specifically looked at different subtypes of flavonoids. So, for example, dietary flavonols. These are the compounds which are present in, like, for example, apples, green teas, dark chocolates, cocoa powder, broccoli, and then oranges, tomatoes, pears, and olive oil. And we found that people who were consuming more of dietary flavonols had reduced dementia risk. Similarly, we looked at another bioactive compound, pelargonidin, which is primarily present in berries. And this is a primary polyphenol that was found to reduce the risk of dementia by almost 35%. Pelargonidin is also present in peas, beans, raisins, and grapes. So what we found specifically for this compound was that it was reducing dementia risk. And then we again looked at the berry intake by itself, and we found that those who were consuming at least more than 2 berry servings a week had almost 24% reduced risk of Alzheimer's dementia. Now, again, after talking about macro and micronutrient, I just want to look back why diet is important. Another aspect of, apart from giving the essential nutrients, which we talked about, diet is also important because it helps you to maintain the gut health. There has been a lot of new research in this area, how gut health can impact your brain health. So there is the establishment of gut-brain axis, and there are studies saying that your gut can very much dictate how your brain and different neurodegenerative disorders look like. So any kind of gut dysbiosis can be affected by your appetite and your perception of pain. It is also linked with your cognitive and motor function in older adults. And obviously, nutrition or what you eat directly impact your gut. So there are different factors which impact your gut flora. When let's say gut flora, there are different microorganisms in the gut, and these are the good microorganisms which help your gut to have a healthy equilibrium or a good digestive system. Obviously, diet is one of the primary component that impacts your gut health. And that's another aspect why diet is really important and make a lot of sense when we are talking about the role of diet in brain health. Now, do we have any questions or should we take it at the end?
If people can raise their hands if they have any questions before we move on. All
Um,
right, Mary Bloom.
Something, yeah.
I just have a quick question. When you say about eating fish, does it matter what kind of fish?
Um, uh, I mean, what I'm saying, eat any fish, so really not specifically, but obviously eating more of the light fish or the oily fishes are which are more in omega-3 are better, but then eating any kind of fish is good. Um, but when we are saying eat fish, it doesn't include eating fried fish for sure, because fried fish
Oh,
includes a lot
okay.
of other
Mhm.
things because
Mm,
you're increasing your fat intake, you are using other things to
mm,
fry it. Um,
mm.
so yeah,
Thank you.
yeah, thank you. I don't see any other question for now, so let's move ahead. Um, the second piece of the talk is about dietary patterns. So there are different patterns. So when I say dietary pattern, it means combination of foods. Again, because food is not none of the food is consumed in isolation. We always eat different kinds of foods together in a plate. And there are different kind of these patterns studied worldwide for its association with different health outcomes. Primarily for brain health, we have seen different dietary patterns being studied, including Mediterranean diet, the Nordic diet from the Nordic region, the traditional Asian diet from Asia, the DASH diet, which is the dietary approach to stop hypertension, and then specifically the MIND diet, which was originated here at Rush. And I will go over two main dietary patterns we study, which includes mind and Mediterranean diet, given the time frame. So why Mediterranean diet? Again, Mediterranean diet comes from the Mediterranean region. This diet includes what the people in Mediterranean region primarily consumes. So this includes whole grains, vegetables, legumes, fruits, nuts, seeds, herbs, and spices. And people in the Mediterranean region were found to live longer, have better cardiovascular health. So that was suddenly their lifestyle and their diet was the interest. And that's how the Mediterranean diet was originated, where researchers try to put together what are these specific foods which people in this region are eating, which is helping them to live longer, have better cognitive health, but have better vascular health. So, this diet primarily includes the healthy factors. Olive oil was a very big component of their diet. And then fish and seafood is also emphasized in the Mediterranean diet. Again, fish and seafood, which is rich in omega-3, we just talked about. And another component of their diet is dairy and poultry, which is recommended to be consumed in moderation. A Mediterranean diet also recommends to you to limit your red meat and sweets. Like these are two components that are eaten occasionally. And there are different reports from different parts of the world on Mediterranean diet and different outcomes, health outcomes. But primarily for cognitive outcomes, there is this meta-analysis that reported that better or a higher Mediterranean kind of diet is associated with lower risk of cognitive impairment and Alzheimer's dementia. So we have also found similar results in our cohorts at Rush, and then there are other reports from different cohorts in the US region as well. So, however, there's a difference in the people living in the Mediterranean region versus those living in the United States, that the eating habits are different. So what we thought was, like, because in the Mediterranean region, eating fish is so popular, and that's such a daily thing for their routine, that everybody was consuming almost 3 to 4 portion of fish each week, which is not the case in the US. So there were different ways researchers tried to incorporate that Mediterranean diet in the US population, and there were different studies on that too. However, I'm not emphasizing the Mediterranean diet in the US, but then I want to talk about the MIND diet, which is a combination of Mediterranean and DASH intervention for neurodegenerative delay. So MIND stands for Mediterranean DASH intervention for neurodegenerative delay, because considering the Mediterranean diet is specifically for Mediterranean region, and DASH diet, which is specifically focusing on hypertension, the researchers at Rush thought that maybe combination of these two components that are specifically uh, for the US older adults, based on what they eat, can tell us more in terms of how these two hybrids, how these two diets and its hybrid can be established diet form that can have impact on your brain health. So it was found that the diet that was helpful for the older adults from the US cohorts included the specific food items. Again, the MIND diet was based on the compelling scientific evidence on different foods and its impact on brain health. We have talked about different macronutrients and micronutrients in our previous slide. So this diet was like the combination of these established um, associations for different nutrients and foods, and then putting them together in a way that there is a combination of different foods, and there are recommendations on emphasizing on certain foods and not consuming certain foods. So that includes the foods that are good for your brain health. So mind that includes 10 healthy food groups. And then it also includes 5 unhealthy food groups that should be avoided or limited. So you can see in this picture, which is like a good, easy diagram to follow. So I always use this um, to like a easy catch and takeaway points. So my diet emphasizes on whole grains. We have seen how whole grain is good for your brain health in the previous slide. It emphasizes on green leafy vegetables and other vegetables. That gives us a lot of carotenoids and other nutrients we have talked about, vitamins and B. It emphasizes on berries. We did see previously that how berry intake and pelargandin in berry helps your brain. And then it also emphasizes on nuts. An ounce of nuts can help your brain. Again, nuts gives you vitamin E, and then it also gives you good fat. It emphasizes on protein sources, including beans and legumes, and lean meats, including poultry, and fish at least once a week. And we have seen how omega-3 in the fish is very beneficial for your brain. And then it tells you to limit certain amount of the fat, the bad fat. The butters and the margarines gives you saturated and trans fat, which we saw was not good for you. And it emphasizes on intake of olive oil, and then limiting the cheese intake and the fried food intake, the full fat cheese intake and the fried food intake, and the pastries and sweets. So the 10 healthy food groups, as I said, include whole grains, green leafy vegetables, other vegetables, berries, nuts, poultry and beans, legumes, fish, and olive oil. And then the foods that should be avoided includes butter, margarine, full-fat cheese, fried food, red and processed meat, pastries, and sweets. And what we found was very interesting. So, did you know like how mind diet was related with different health outcomes? And we specifically looked at different health outcomes, including Alzheimer's dementia, cognitive impairment, motor decline, disability, and depressive symptoms, as I indicated previously in my slide, that this is what we are trying to do in our study. And interestingly, in our study, we found that those who were following the MIND diet had almost 35 to 50% reduced risk of Alzheimer's dementia as they were aging. We further also found that the improvement in people's diet in just one area, such as eating more than 6 servings of green leafy vegetables per week, or consuming one or more fish servings, or not eating fried food, was associated with fewer amyloid plaques in the brain. Amyloid plaques are the hallmarks of disease, and this is a picture like once we get the brains. We also look at the plaques formation and the tangles in people's brain and then look back what they were eating. So in this study, we were able to find that people who were eating better or just improving in the one mind diet component was helping their brain being younger as much as 4 years young. Which was huge for us. And then we further wanted to understand how about if people who are also eating unhealthy but healthy foods together. So in this, to tackle this kind of question, we wanted to study if eating unhealthy food components in your diet can offset the beneficial effect of the healthy components of your diet. So we are saying that one should eat healthy, but sometimes people eat different kinds of food. So maybe there are people who are consuming fruits and vegetables and a lot of legumes and whole grains, but they're also consuming the unhealthy components, and that's also called a Western diet, which includes more of red and organ meat, more of butter and fried foods, and then refined and sweet foods. So what we specifically found in this study was there were people who were consuming more of the Western kind of style, even though they were consuming the healthy component, they were also consuming more of the unhealthy component. And we wanted to separate out if that makes a difference. So what we did is we separated our participants into two groups, in low Western diet group and a high Western diet group. So on the left-hand side, you see a low Western diet group results. So I'll just try to briefly go over what these results mean. It's that people who were consuming low Western diet, so they were consuming less of any kind of those unhealthy components we talked about. And what we found in these people is that their Mediterranean style of diet was beneficial for their brain health. So here we are looking how their cognition changed over time. And as you can see, the first two brown lines shows us like how their decline was less over time versus the orange line where the people were consuming less of the unhealthy, but they were also consuming less of healthy components. So their decline was rapid over time compared to those who were consuming the good Mediterranean style of diet. So among the low Western diet consumers, there was a beneficial effect of Mediterranean diet. However, when we looked at the group with a high Western diet score, so even though they were trying to eat fish and like other things and fruits and vegetables, but they were also consuming a lot of fried food and sugar and other Western kind of food, we didn't see that kind of beneficial effect, which we saw in the other group. So that again indicates how eating an unhealthy kind of diet or more Western kind of diet may attenuate the beneficial effect of your healthy components in the diet. And with that, I would like to summarize that when we talk about a healthy diet, it overall does help your brain, yes. That's what we talked about in these slides. But then it is not just helping your brain, it also helps your heart and it also helps your overall well-being. Because these are the healthy dietary components which are also important for your vascular outcomes. So healthy diet not only just relates with better health, brain health outcome, it can also give you healthier heart, it can improve your diabetes, blood pressure, so it helps your hypertension and it reduces the risk of any kind of myocardial infarction in future or strokes or other kind of vascular risk factors. Then in older adults, healthy diet has also been shown to help with body weight. It is very much required to maintain your muscle mass and motor activities. And overall, healthy diet is also known to help anxiety and depressive symptoms. So, again, if the healthy diet, if you are consuming healthy diet, thinking that it's for your brain health, it is also helping your heart and also helping your overall well-being. And there are different things which you can incorporate in your daily life. Again, this is to incorporate different things so that it's kind of your lifestyle rather than a set kind of routine or a set kind of diet. So what I've talked about today, it's more emphasizing how including these specific foods or specific nutrients in your diet do make an impact on your brain. And these components are such that they can be easily incorporated in your daily eating habits, in your daily diet. So for example, these are just some of the examples, but there are so many such examples, but I've just listed some of them, such as include more whole grains. Example, whole grain bread. You can use a multi-grain bread. Try using more of wheat tortillas, quinoa, couscous, or any other kind of millet. Try to include more of vegetables in your diet. These can be raw vegetables or cooked vegetables, a salad or a soup, any kind of vegetable in any form is good. Try replacing your red meat and the processed meat with baked, grilled, or broiled chicken or turkey options. Again, we do not emphasize on fried chicken options. And try to use herbs to enhance the flavors in case you find it bland, like the baked or the broiled ones. Try to include legumes and beans in your salad and soups, or combine it with whole grain. Or other examples to consume or increase consumption of legumes and beans can be include hummus, tofu, or lentils in your diet. Then again, another thing one can do is consume more of healthy fat. For example, try to consume olive oil, fish, or other kind of seafoods, or seeds, example, flax seeds, chia seeds, and other nuts. So these are a few things that can be incorporated in your daily life, again, to increase the consumption of foods that have shown their benefits for brain health, or to increase the consumption of the nutrients which are eventually helping you to perform better in terms of your cognitive health as well as your motor health. And with that, I think I would like to summarize what we have learned over time. But before going on to summary, probably we can see if people have more questions on this section.
Okay, we have a question from Valerie in the chat. She says, did you study a totally plant-based diet on brain health? I assume that because of the omega-3 and protein needs that you found a diet needed fish and poultry, that a supplement couldn't make up for what the food category provides.
Yes, that's a very good question. And yes, we did see and looked at a plant-based diet score. And when it comes to plant-based diet, there's a healthy plant-based diet and an unhealthy plant-based diet. Again, when we say unhealthy plant-based diet, sometimes if you're not consuming a lot of meat, The alternative options is to consume a lot of refined grains or sugars and pastries and sweets. If that's happening, then that is considered as an unhealthy plant-based diet. But what we found is that people who were consuming healthy plant-based diet had better cognitive performance. So even though they were not consuming enough of fish that is recommended in my diet, they were at least consuming the other fruits and vegetables and essential oils and things like that coming from these plant-based foods. And we did find that there is a beneficial effect of plant-based diet. However, it is difficult to study such plant-based diets, I would say, given specifically our US population here, because there are very few vegetarians, specifically in older adults. So I think, in summary, we did find an association of plant-based diet with better health outcome. But we definitely do need more studies in populations primarily just eating plant-based sources. And there are other studies which are specifically looking at these outcomes in plant-based versus non-plant-based products. But you're right. If we can replenish or include the important nutrients through our different vegetarian sources, that's good enough.
And then Diana asks, is olive oil the only healthy oil?
That's another good question. I would not say that that's the only good healthy oil, but that's oil that has been extensively studied, and that's why it was picked for our. We have a lot of evidence for olive oil, but then there are now other oils that are coming up. For example, the avocado oil, which is high in MOFA, monounsaturated fatty acids. Then there are canola oil, which is again a good omega-3 to omega-6 ratio that can be consumed. So there are different oils that can be an alternative for olive oil if you do not like to consume olive oil, which is rare in our country. But definitely there are other kind of oil that can be consumed, which are rich in omega-3 or monounsaturated fatty acids.
So if somebody cooked their fish in olive oil, they could have fried fish?
Uh, no, I would say,
Okay.
because once you fry in olive oil, like olive oil has a low smoking point, and then that changes the composition of oil. So it's not recommended to consume um that. And B, when you're frying your fish, it's usually sometimes you're adding a lot of like other things, breads. If it is a breaded thing, you're coating it with another things that kind of changes the composition. But I think shallow frying is fine. I think it's more of deep frying that changes the composition of the oil and the food,
Okay.
which should be avoided. So, mhm.
Great. Do we have
My,
any other questions if somebody would like to put up their
yes,
hand? Go ahead.
well, my name is Elizabeth Williams.
Mhm.
I'm curious, how how is it through your study that you have multiple um, siblings or that has the same uh, dementia or Alzheimer's disease if it's caused by the substance that they eat?
Okay, if I understand your question correctly, I think you're trying to ask if we had a sibling or a twin study, kind of a study design where they were consuming similar foods but had different outcomes.
Yes.
Yeah, so I in our study, no, we don't have a lot of siblings or um things like that. But there are other twin studies, and I don't know if you've seen there is a thing in Netflix. I don't know if it's still on, but it was about a twin study where they give half of the twin one kind of diet and another half another kind of diet. And they found that eating certain specific foods, which are plant-based foods, improved a lot of their health outcomes and impacted their microbiota in some ways. And there are other twin studies also which have found that even though you're genetically similar, there are different lifestyle factors that can impact, such as diet, that can impact your outcome in the long run.
Okay, thank you.
Thank you. Any other question? Okay, I think I will go ahead and summarize, and then we can take few questions in the end. So what did we learn today is that nutrients do come from various food sources, and they are important to maintain our brain health as we age. Macronutrients, including carbohydrates, proteins, and fats, are important. The complex carbohydrates, lean proteins, and healthy or good fat is something which is recommended for maintaining your brain health. There exists compelling evidence for the relationship of micronutrients, including antioxidant nutrients such as vitamin E, carotenoids, and bioactives, including flavonoids and their subclasses, and the B vitamins with and their relationship with cognition and Alzheimer's disease risk. We also do have enough evidence now that the food that are recommended under my diet, including the green leafy vegetables, whole grains, berries, other vegetables, olive oil, and fish intake, that are primarily rich in these nutrients, impact your cognition, Alzheimer's dementia risk. And I said we have also looked at other outcomes in these older adults, such as people who are eating better diet or better mind diet, had less disability, also had slower progression of Parkinsonian signs, and other health outcomes. And we also saw, when we were talking about the Western style or the unhealthy and the healthy foods, we saw how they might interact. So it is important that when emphasizing on healthy foods for cognitive health, the dietary recommendation should definitely include what one should also avoid. So avoiding unhealthy foods such as red meat, fried foods, sugary foods, and the refined grains should also be emphasized while we are talking about the foods that should be consumed. And with that, I would like to thank you all for listening. And I always go by this saying, this is one of my favorite one, the food you eat can either be the safest and the most powerful form of medicine or the slowest form of poison. Poison is a strong word, but then I definitely believe it can be one of the most powerful form of medicine. And there is this whole thing of food is medicine, which is going on. So definitely by modifying what you are eating, I think you can modify a lot of your risk for various outcomes and specifically for brain health. And thank you again for listening. I'll take more questions. And in case there are more questions which you think or you might have in future, you can email me or tweet about it later. So with that, I think I'll stop sharing. In case we need slides, I can pull that back up. Dr. So do you think we can just probably now take more questions?
Yeah, let's open it up for questions.
Mm-hmm.
Okay. Geraldine, did you have a question? No. Okay. I had a question. It looked from the graph that you were showing that people can improve over time with either the Mediterranean or the mind diet. So even if they might have been at high risk, it looked to me like they can make a change to
Yeah.
be less at risk.
That's correct. And then I think something which I did not mention here is that whenever we are looking at such things on establishing how diet is impacting brain health, there are different ways of doing it. And in our statistical procedure, we do control for various confounding factors. So the graphs I was showing, they were all controlled for other known factors for dementia risk, such as age, education, physical activity, cognitive activities, or their vascular health. So an EPD, which is one of the strong genetic risk factor. So definitely, these are kind of robust findings indicating that on top of these things, there is an independent effect or an independent association of diet with these outcomes, which is promising in a way, like someone with a, as you said, even with a high risk might have some beneficial effect.
Were there any variations for Parkinson's disease?
So we don't have a lot of people with Parkinson's disease. Specifically in our data sets, I looked at Parkinsonian signs progression, and I did find the similar kind of results. I didn't show that graph here, but did find that people who were on a better mind diet score were progressing, like they had a slower progression of Parkinsonian signs over time. The UPDRS scores, we do the UPDRS at each clinical visit and then looked at it on how that's changing over time.
Oh, thank you.
Mhm.
Are there any other questions? People can unmute or raise their hand or put it in the chat.
I have a,
Go ahead, Geraldine.
okay. You mentioned earlier that we should eat a lot of fruits and vegetables.
Uh-huh.
But when I eat grapes and watermelons and fruits of that nature, it has the tendency to raise my sugar.
Hmm.
So how do I offset that with another
Fruit.
yeah,
Yeah.
because I
Yeah.
love grapes, but if I eat more than six, it's gonna shoot that sugar.
Yeah, grapes are that like they are high in sugar con like the glucose content do get higher. So when it comes to certain fruits such as grapes, mangoes, banana, these are the ones which can increase your blood sugar. So people who are diabetics do have to take care of these certain things and there are definitely other fruits and that also depends on individual. Like sometimes some things are good for you. I mean, they don't raise blood sugar for you, might raise blood sugar for others. So if you're not consuming like grapes and other things, you can try out other fruits, such as like guavas or pear, peaches, apples. Um, so I mean, I do get that. My mom is diabetic, so sometimes it's like that certain fruits can hit your blood sugar level in certain ways, and you should try avoiding those rather than consume the other ones.
Okay,
Thank
thank you.
Mhm.
Thank you.
I wanted to know, could somebody get just as good a benefit from taking like vitamin B and vitamin E supplements as they could from eating the foods with that?
And that's a good question, and I do get this one a lot of time, and I was thinking of including a slide, but then I didn't. But supplementation is something which has been studied widely, and specifically in our studies, we always found that all the data I showed you were the nutrients coming from foods. And we never found that if we added the nutrients coming from supplements also, because that's something which we always gather from our participants, nutrient coming from supplements never added anything to our data. So it was always nutrients coming from food, specifically for our data sets. But there are few studies and there are mixed finding mostly when it comes to supplements. There can be different reasons because when you eat supplement, A, they're in mega doses sometimes, and B, the way it has been absorbed in the body might be different. So a nutrient coming from food, because it's in combination with other nutrients and with other factors, it's consumed and absorbed differently in our system than the way vitamins and mineral supplements are absorbed. However, said that there are certain new supplements you have to take. If somebody is deficient in, for example, vitamin D, B12, definitely your physician is going to put you on some medication or like some supplements or over the counter. So it's always individual based. If you are deficient, definitely replenishing yourself with supplementation is important. But other important thing to consider is the best way to get any nutrient is through food, the way we can absorb it. So definitely the first choice should be food, but then sometimes supplementation is necessary and help certain people.
Thank you. We have Angela asking, what other fruits can we eat during the winter months?
What other fruits can you eat? Actually, you can eat any kind of fruit, I would say. If you're, I mean, considering diabetes, the list is limited. But then if not, you can consume any kind of fruit. And specifically, I understand like in winters we have limited supply, and then there are more seasonal berries and stuff in summer than winters. However, we do get nowadays, thanks to all the advanced food production systems and the storage systems, we do get most of the fruits year round. But any kind of seasonal fruit, whatever you like, papaya, from papaya to any other kind, can be consumed for your fiber intake and for other nutrients as well. So there's no
Elizabeth,
specific one. Sorry.
Elizabeth Williams again. What if you have that stomach that when you eat a lot of fruits, it kind of messes with your stomach, you know.
Oh,
You
yes.
find yourself in the little girl's room more than at the older age than I am. I'm 81. And
Yes.
you be in the little girl's room more than is necessary.
Yeah, so the recommendation is to eat like 2 servings a day, mostly. So try to stick to that and not go beyond that. That's the recommendation for American guidelines as well for fruits. But you are correct. Like sometimes because of the high fiber content or because the way they're digested, it might not work for everybody. So one has to understand like what's working best for them. So it might vary from person to person.
Okay, thank you.
Thank you.
Would eating dried fruits like apricots or prunes be the same as eating the fresh one?
Not same, it'll be similar. So once the fruits are dried, there is a lot of vitamins that are leached out during the process. And then some of the vitamins, for example, vitamin C, because it's heat labile, it just goes down. So, I mean, consuming that is better if you can't have like the fresh ones. So having something is better than nothing, but if comparing, then fresh is better than the dried.
Okay.
Mm-hmm.
Are there any last questions? We can take one more. All right. Seeing that there are no hands up or any other chat, thank you so much, Dr. Agarwal. We're very appreciative of your time here and sharing all of the information about nutrition. While it's something we all do every day, it's something we often don't think about and how much it does affect our brain health. So we do appreciate your time and expertise in this area. Oh, I have one new message. Hold on. Let's see. Oh, thank you. The audience thanks you as well. So
Okay, thank
very
you so much.
appreciative.
Yeah, thank you so much for having me.
All right.
Thanks.
Have a good day. Thank you. Bye.
Bye-bye.
Thank you.